Chapter 7, Ureter Catheterism. The day has at last dawned when substitutes for the ureter catheter are not. If the ureter cannot be catheterized, we realize the inaccuracy of the separators of Harris, Catherine, and Louis, and the danger of depending upon meatoscopy. Bilateral exploratory nephrotomy gives the only prospect of a diagnosis, and the information afforded by this method of examination is far less accurate than that afforded by the ureter catheter. The catheter. The best ureter catheters are those of French make. For many years past, I have used the instruments made by Einard. Size. The ideal size of a ureter catheter is 6 or 7 French, 12 to 14 for the Einard. The lumen of a catheter smaller than number 5 French is too small to convey the urinary stream, and even 7 French is too large to enter many ureters without considerable trauma. Therefore, I usually employ a 6. The Garceau catheter I have never employed, though it might be useful to dilate a stricture. Markings. One should make it an absolute rule never to use 2 identical catheters for an examination. There must always be a distinction between that which is to enter the right ureter and that which is to enter the left. This distinction should be announced aloud before the examination and should be verified aloud when the catheters are in place and the cystoscope withdrawn. If any dispute then arises as to which catheter is in which ureter, the prevailing opinion may be verified in the female by vaginal palpation of the ureter as each catheter is withdrawn, and in the male by injection of enough fluid to cause a slight renal colic. Inasmuch as one is interested to know how far the catheter enters the ureters, the most popular type of instrument is painted black on each alternate centimeter and ringed with gold at intervals of 5 centimeters, so that by watching the catheter enter the ureter, one may estimate precisely how far it has gone. It is my custom to use for each examination 1 plain catheter and 1 marked off in centimeters, as the equal rings and markings on one will give a precise estimation of the position of the other, and it is impossible to confuse the two. The tip. Every ureter catheter should have at least 2 eyes on opposite sides. The flute-tipped catheter, figure 25, is the best instrument for ordinary use. In case this fails to enter the ureter, an olivary-tipped instrument will often succeed.